I'm Dr. Sanjeev Chitragar, your pathology faculty, and let me just give you the brief idea about how pathology as a career will be there. So let me start with the basic. I'm Dr. Sanjeev Chitragar, your yeah. So let's. So everything is all right here. So let me start with my first slide here. Let me look at my first slide. So what is this? Okay, I'm going to talk about first, let me put the whole pathology under microscope and let us check what exactly are we going to do in pathology here, right? So let me start with this basic understanding. Okay, so what is a pathologist's job? What is it? How is it different? First, pathology as a subject from UG is totally different in PG. Absolutely totally different. How is it different in PG? In PG, you will be having more only on diagnostic. PG, you are more into the diagnostic mode, and in UG, you are more into pathogenesis mode. So you should understand this point that you are no more going to, just be happy about reading the pathogenesis of the diseases, right? So that is what is a primary difference. And many people ask me this, sir, in my UG days, I was just looking at slide numbers in my practicals and I was passing by that. Is that any problem for me? Is that a no for me to select a what do you call super specialization as pathology? Answer: no, that is not the case. Everyone, including me, most of us ended up what? Knowing the slide numbers in the colleges as an undergraduate, and many of us used those things to diagnose or make your correct answers in your undergraduate days. That doesn't mean that you are not going to be a good pathologist. No. So all that you require for being a good pathologist is an open mind, and you should not be a color blind. That's the only thing that is required here. Okay, so that is the first thing. Next, let me talk about further. The subject pathology itself is vast than many other subjects. So it is very vast because as a pathologist, I need to know tumors of the brain, so tumors of the heart, very rare anyway. So tumors of the lung, I need to know leukemias, lymphomas, tumors of the skin, tumors of the bone. So it is like a package wherein you have to know tumors or pathologies, diagnosable pathologies in almost every branch. So in almost every branch you need to be thorough with. That is the reason why it is very vast, and that is why in fact this vastness itself makes it more challenging as well. So it is definitely a subject for those who challenge themselves. Like, you will feel happy when you are going to be challenged by this subject here. Okay, that is one. Next I want to talk about important next thing. I just want to talk without proper diagnosis. So without your proper diagnosis, clinicians are in the blind. So basically clinicians will only be able to treat properly if your diagnosis is correct, and that is the reason why there is a huge demand of good pathologists. I'm telling you, for very long pathology has been taken by those people who just want to do 9 to 5 job, and predominantly people think it was female centric branch. That is not the case. So if you are a good pathologist, your demand is very high nowadays, because there are no good pathologists in, especially in the corporate world. They want to have very good pathologists because they want to have better treatment, they want to have a better diagnosis, everything. Only one problem is, or you might call it problem, you might call it as an advantage as well, both of the things. So there will be no contact with the patients directly, so you'll not be in direct contact with the patient. So you probably, if you are not a kind of a person who doesn't want to see suffering everything or with your own eyes, although your diagnosis means patient might be making a huge suffering can be happening to the patient, but still you will not be seeing those suffering that is happening with the patient. So it's a good thing as well as bad thing, both, by the way. So for some people, patient, if you are a kind of a person where you want patient touch, then this is not the subject that you are looking for. Next let me talk about okay, so what does a pathology offer as a career? So what does pathology offer to me as a career? And I'm quoting this from a very recent article from Oxford. Now, so this is about pathologists. Okay, they had done a detailed study about pathologists and they had asked these questions. So what are the questions here? So the blue one is disagree with the question, and the orange is agree strongly, and not sure or don't know are the gray ones. Okay, I enjoy my working as a pathologist. 91.2% people are saying yes to this, agree strongly to this. Next, I have accomplished worthwhile things in my job, 90%. Look at the satisfaction rate. I feel valued by my colleagues, 80%. Yeah, slightly lesser. Then I feel valued by professionals outside my team. That is also slightly lesser point. Next, I feel respected in the field of pathology, slightly lesser. So this, see, look, the others perspective, the points are lower, but your own perspective, it is almost what, 90% here. I generally feel energetic at work, again 70%. So look at this, the job satisfaction in pathology is very, very good. So if you ask me, am I satisfied as a pathologist? Absolutely yes. So job satisfaction is very, very high in pathology, and that is one of the reason why people tend to take pathology. Job satisfaction. Next, I want to talk about why job satisfaction is happening. You need to understand this point as well. The reason being, many people end up saying pathology. Okay, only I've seen people who have got good ranks and have taken pathology, and they have done very, very good. Is pathology difficult for high myopia? Answer is no, not difficult, because you're always going to see under a microscope. Okay, so it is not much of a problem. Okay, so now, why is there so much high job satisfaction that we are talking about? Your diagnosis determines the treatment modality in most of the cases. It is 100% in oncopath case and in nephropathology. So two upcoming branches, nephropathology and oncopathology, you are the must. Only thing is, patient might not give you that what do you call, feedback, saying that, okay, Doctor Saab, you are the one who ended up making my diagnosis correct. Sometimes that will also happen, because patients would be treated wrongly and you make a diagnosis correct. That has happened with me many a times. So that time that is there. Otherwise, usually patients do not tell you that they are happy with your diagnosis. Of course not. Okay, don't expect that. So, but however, you yourself know that if your diagnosis is not going to be correct, a clinician is going to be not treating it properly. So your value is the most important, based on which treatment is going to happen. Okay, next one more important, variety of cases. So daily you will end up seeing a lot of cases, different cases as well. As a pathologist, I will today sign out a lymphoma, probably tomorrow I'll sign out a bladder carcinoma, day after tomorrow I might sign out a ovarian carcinoma, and after that I might end up signing out a endometrial carcinoma, etc. So I myself am seeing a lot of variety. This is lacking in most of the subjects. Two subjects which have such a variety are radio and patho, because these two people end up having lot of cases coming from everywhere. Okay, so this variety itself makes it non-monotonous branch. So you will never get bored. You unlikely to get bored. At least 20-25 years of practice, you'll end up seeing one, almost it will be what, different cases that you will be seeing. Clinical hematology, as of now, it is not there. Earlier it was there. Now clinical hematology for MD path students is not there. And if you are looking for to enter into clinics, usually it happens, those who join pathology and those who start liking pathology, they would not like to go back to patients. Okay, next, one more reason, work-life balance. Work-life balance, probably no other branch offers so much of work-life balance. Most of the times you will be free by 5-6 whatever time, so you have enough time for your family, you have enough time for yourself, etc. So work-life balance is very, very good. Not DM clinical hematology, you can do a hematopathology is there, you can be doing a DM hematopathology. Okay, again that will be diagnostic only. Next, no emergencies, no night duties, and that is the reason why satisfaction is very, very high. Then one more reason is, we give justifiable time to each case. What do I mean by giving justifiable time to each case? You are sitting in a clinic, you don't have enough time, you end up what, diagnosing you investigate something and you send the patient, and you don't have enough time to think about the case also. Whereas for pathologists, that's not the case. I get a slide, I see it, and I feel it is a new thing that I've seen, then I will open my book, I will end up reading about that, and then I will probably discuss with another colleague or senior or anyone, and then make a diagnosis. So what is happening is you are learning and you are, so this is a constant learning and practice mix that is there, where there is no pressure from the patient that अगर मैं पेशेंट के सामने, मान के चलो मैं क्लिनिशियन हूँ, मैं किताब खोल के बैठूंगा वहां पे पेशेंट के सामने, patient will not trust me at all. That is not the case with pathologist. So pathologist, this is the best thing that is there. So we have justifiable time for each of the slides or the cases that we are talking about. Next I want to talk about what about earning. So people say about the earning, I would say, if you ask me, it is overhyped, unnecessarily too much of hype is happening. Why? I would say, okay, so there is a fair compensation. I would say it is fairly compensated, around beginning around 1.2 lakhs to 1.5 lakhs per month. As of today we are having a salary, I mean as of last year. So that is what is the range that is going. If you once you get experienced, you will end up having better salary as well. Now, why I say this salary or the compensation has been unnecessarily hyped? Because of this. What is that? See, money has a ceiling effect. Remember, what is a ceiling effect? There, to certain extent, money will make you happy. See, you are earning hardly, you probably are earning currently 0 rupees. So you are dependent on your parents. You start earning somewhere around 2 lakh rupees. You make happy, you become happy. You buy a car, you buy a house, you all those things. And then say suppose from 1.5 lakhs, if I give you 2.5 lakhs, that is still okay. And anything beyond that, what happens is you just are going to not spend that money. And this is what is the ceiling effect. So after a certain point of time, or after a certain amount of money, you will not be having that, happiness. Money is not going to give you happiness. Of course, money is going to give you happiness to a certain level. And beyond that, money is not going to give you happiness. And that is the reason why. So don't just look for a branch just based on money that you're going to get, because in 5 years you will end up feeling bored about that branch, and you will end up having very difficulty to sustain that branch for next 20 to 30 years in your practice. Yes. So now, so this is what, and earnings are better when you open your own lab. Obviously opening your own lab is a business. So remember, money can't buy you everything after a certain level. That is what is a ceiling effect is there for money. Next I want to talk about yes, what after MD or DNB. So if I finished my graduation, post graduation, basically what is there after this? So what after MD or DNB? So there are multiple options that are there after MD DNB for you. What are those? One, you can be doing a senior residency. So you will be doing a senior residency immediately. This is if you are interested to enter into, usually I would recommend senior residency for most of the students. Whether you want to go into teaching or not go into teaching, do a senior residency at a good place. Next, be an entrepreneur. Open your lab. The initial investment for lab is around 20 lakhs, 25 lakhs. Not very high amount. But yes, returns will be good if you are going to, and especially if you are going to open a lab in a tier 2 or a tier 3 city. Do not expect yourself to open a lab in Delhi or tier 1 cities. Definitely not. Tier 2, maybe tier 3 cities also are good enough, and you will be like one of the most important person there, and your lab will be good, and you will end up earning better here if you are opening your lab. Teaching in medical colleges, that is not only in medical colleges, medical, dental, paramedical, all those things as well. Next is large number of vacancies are there in medical colleges. This is happening in a few years. Most of the senior, professors are going to be retired, and what has happened is there is a need of more number of pathologists as well, and that is the reason why I say there is a lot of demand for teaching in medical college. And it is almost that we currently are having around 500 medical colleges. India is expected to boom in medical colleges. Another 200 medical colleges are going to come in the next few years. Okay, so that is one. Next, you can do DM fellowships. You can join a corporate hospital as well, especially if you are doing onco, nephro, etc. Passing rate of DNB should be not much of a worry. Okay, I'll come to that. Now, next is saturation. So, what about saturation? Is pathology saturated? People keep asking me, sir, this branch is already saturated. For them, my answer, I'm going to give you answers based on the facts that are there. Okay, so with increased life expectancy in India, life expectancy in India has increased significantly, and environmental factors like pollution, all those things, the incidence of cancer is rising at an alarming rate. Alarming rate, very alarming rate. Let me tell you the current cancer burden in India. Last year, 1.5 crore patients have been diagnosed of one or the other form of cancer. I'm talking those who have been diagnosed. There are many people who would be one, so this will be a tip of the iceberg probably. Okay, yes. Now it is estimated in the next year 2025 this caseload is going to be 3 crore, double. And it is estimated in another 10-15 years, one in every 9 patient in India might be requiring a biopsy for ruling out cancers. So we are talking 1 in 9 in a patient, meaning I'm talking almost of what? So they will be requiring a biopsy to rule out cancers. That means there will be at least as of today we are taking 1.5 billion, and let me say assume that only out of 1.5 billion, 1 in a 9 is almost 10%. So we are talking around what? Yes, we are talking 150 crores. Around 15 to 20 crore people are estimated to require your expertise. And that is why I would say this is the biggest myth buster. If you think you are having one, there is a saturation. No, this is not the case. Saturation is there only. Okay, you expect yourself that I join this course and nobody should be competing with me. That is wrong. That's going to be there with every branch. So that is why there is no. So we definitely need people to diagnose these, treat them as well. So there is no dearth or no shortage of jobs. Whether you want to join a corporate hospital and become into oncopathologist, or whether you want to join a medical college as well. Now, so what are the further career options in pathology? So what after? So people keep asking this. First thing I always tell this, what is that? Just pause and hold on. One very mistake that most of the medical students are doing, they are getting thrilled just by cracking examination. That is not the case. So that is why people end up what? Keep adding up more and more qualifications to them, until there is no more qualification left, and they still are not satisfied. The reason being, see, so you need to understand that you have to look for satisfaction not just in exam. You have to look at satisfaction in daily diagnosis, daily seeing. Whether you are joining a clinical branch or a non-clinical branch, you should see this. You have to enjoy and you have to get satisfaction from that. It is not just getting on 100 out of 100 or topping a exam, or being in the top 90th percentile. Of course you will end up feeling happy. So what all options are available? DM histopath is available in PGI, then DN hematopathology is available in PGI and AIMS, and even few other colleges now. DM oncopath, and there will be DM and DNB, both are there, all these things. So DNB SS I'm talking. Oncopath is there in Tata, Kidwai, etc., and 4-5 places. Then fellowship is there in neuropathology in NIMANS, fellowship in nephropath in PGI. Many corporate like Lalpath is offering fellowship in GI pathology is available now. So GI pathology is also very upcoming branch. There is option of doing a research PhD. If you want to go abroad, this is a better. Many people who want to go and settle outside and like in US, etc., they take pathology as a route, join pathology here, and end up doing residency later on in pathology, because you will end up usually getting a match in your USMLE as well. People do that. Okay, so I know many from AIMS, my seniors have done that. So many of them finished their MD, they went to US, they wrote USMLE exam, they went to US and they joined there as residents, and they would be obviously more experienced because they already had worked 3 years as a resident here. Now, so there is one more associated branch, immunohematology and blood transfusion. So this is a new branch that has come. So it is a very new branch and it is upcoming branch. What do? You should know their job. They do HLA matching, they manage the blood bank. So basically they are going to set the protocols for the blood bank, cross matching, all those tests in the blood bank, etc. They will be managing. Now importance of this, you need to understand, subject is very limited. So, the only HLA matching is there and, the blood banking is there. So subject is very limited. So it is not challenging like pathology. So you might not be as thrilled as you are being a pathologist in these branches, in this branch, right? It is very limited scope, limited subject is there, not scope. The scope is very good. Why the scope is very good? Because most of the corporate hospital would be requiring a such an expert who is trained people, and there are very less number of trained people. There are very less number of trained people. Can we settle in Middle East, Australia with MD or DNB? Yes, of course. With DNB, many of the Middle Eastern countries end up recognizing your DNB. And for Australia, you have to write one exam. Okay. So that is it. Now, next, MD versus DNB. So MD and DNB are equivalent. Remember this. Only thing is, now few advantages. DNB hospital have better infrastructure like IHC, flow cytometry, FISH, etc. Okay, so all these are better with immunofluorescence, etc. are better with DNB as compared to MD colleges. Although there are few MD colleges which are having good infrastructure as well. So next important point, this should be known. There is still some bias towards MD for medical college. So if you are trying to join a medical college, there is a bias towards MD. Although we say they are equal, the qualification, it will state that either it should be MD or DNB or equivalent. That will be the qualification they will be pointing. But still they end up preferring for those who have worked in medical colleges. The reason being, or who have done in medical college, because they have got the exposure to that corresponding setting. Similarly, there is a bias exists for the DNBs in corporate hospital. So you are joining a corporate hospital, they are going to prefer a DNB over a MD graduate, because again the same thing. This fellow has done DNB in a corporate hospital. He already knows how does a corporate hospital work. So he will end up, the interest of the candidate and the interest of the organization are aligned here. And that is the reason why. So if you want to join a teaching job, then MD should be more preferred than DNB. If you want a corporate job or open a lab, then DNB should be more preferred than MD. So somebody is asking me, should I take DNB in Gangaram or MD path from UP colleges? So this is the first thing that you should be deciding. So you want to join as a teacher, then I would prefer MD there. If you want to join in a corporate, definitely want DNB. Okay, so that is the primary thing that you should be. Because of this, slight bias is there. And this actually, I won't say bias. This is actually because the alignment of the interest. Somebody who has done MD in a medical college, he knows better that there will be a teaching, there will be a practical, there will be a theory. All those things he will be already adjusted to that. That's why medical colleges prefer MD candidates over DNB candidates. That doesn't mean if you are exceptionally good in DNB, you still can be selected in a medical college as well. And the same thing opposite in corporate hospital. Corporate hospital will prefer DNB candidates over MD candidates. Again, this doesn't mean that I end up taking only DNB over all medical colleges. No. So if there is a medical college which is having a good infrastructure, I would prefer that over a DNB. Okay, I'll come to the list as well later. Now, pass percentage of DNB, although is slightly less. Pass percentage of DNB is slightly less as compared to the MD, of course. But within the DNB, if you are talking, the pass percentage in clinical is far less than MD. So MD people, clinical is far less than pathology. So DNB pathology as such, when you compare it with MD pathology, pass rate is slightly lesser. But DNB pathology with other DNBs, DNB pathology has a very high passing rate as well. Okay, so that is one. And don't worry about passing rate because, maximum what you might take another 6 months to clear your exam. Okay, and that is your MD versus DNB. Now, college preference. So college preference in general, I will make first that usually colleges or hospitals which have more surgical caseload have a better pathology department. Is DNB can be a professor in medical college? Yes, he can be a professor in medical college. Only thing is, as I said, they prefer more MD. Okay. See, DNB has become equal to MD only a few years back. Earlier, DNB was not equal to MD. एंड दैट इज द रीजन वाई जो पुराने प्रोफेसर है ना अभी भी वो सोचते हैं कि अरे यार ये तो डीएनबी है, लेकिन आज का जो डीएनबी कर रहा है वो थीसिस भी सबमिट करता है, वो सब करता है, लाइक वट एवर इज द एमडी कैंडिडेट डूइंग, एंड दैट इज वाई इट इज इक्वल नाउ. ओके, सो yes, now, so in general I'm going to talk about colleges. These are the general colleges. In individual states we have to discuss about them. So in general, one, Tata is for oncopath. This is the best place. I would rate this is best after AIMS and PGI. So Tata is, or it is at par with AIMS and PGI also. So Tata Memorial Mumbai. Then UCMS in Delhi. Remember, UCMS is better than MAMC for pathology. मैमसी का सारा जीबी पंत का जो है सुपर स्पेशलिटी हैव बीन आउटसोर्स, सो नथिंग कम्स टू मैमसी देयर, दैट्स व्हाई. सो आई वुड गो विथ UCMS. देन Bombay, KEM and Grant, then Safdarjung, then MAMC, then Kidwai in Bangalore. Kidwai is a very good, where there is very huge caseload, good caseload, around around 20,000 cancer cases per annum. And then BHU, then LHMC, and then I would say DNB, and then other colleges. So this will be my preference. KGMU and PGI Rohtak, almost I would rate them same. So it is maybe PGI Rohtak a little bit on a higher side. It depends where are you from. So if you are from UP, better take KGMU. You can do that. Okay. Yes. So, and also if you're settling in Middle East, DNB is a preferred. DNB will be preferred because usually when you're going to Middle East, you'll be going to a corporate hospital. So that is why DNB will be preferred there. Next, what to expect? SGPGI Lucknow is very good. If you want, SGPGI, if you want to add, it will come somewhere at the top here. So, SGPGI will come here somewhere before your BHU, SGPGI will come. Tell us MD colleges. These are the MD colleges which are with good infrastructure. Okay, list like NIMS, Gandhi Medical College, Osmania, Guntur, Siddhartha, Vijayawada. So in this, I know NIMS is good. In this, NIMS is good, and Gandhi, and these two are good. That I definitely know. Siddhartha in Vijayawada not so good. Guntur, I do not know, but Siddhartha itself is not good. So Guntur, I don't expect it to be better than that. And Osmania College is okay. So if you are keeping, this will be your proper order, I would say. For Andhra, this will be the proper order. What you have kept will be a proper order. But if you want to join corporate, I would keep, after NIMS, probably I would like to keep them before the peripheral colleges. RML after LHMC. Yes, RML will be after LHMC. It will come under top or probably before. RML is more corporate hospital. That is why before. Okay. Only thing is in this Kidwai is one which is having a low, stipend, whereas Delhi colleges are having a better stipend that you have to, look for by yourself. Okay. Now next, I want to discuss what to expect from the college. So very, very important. Many people end up having this, getting disappointed in their first MD. What is that? There will be no formal teaching in any of the colleges. So remember, you are taking any branch. For PG, there will be no formal teaching happening. Whether you join a medical college, or whether you join a corporate hospital, there will be no formal teaching. So how do you learn in pathology then? You will see slides, make a diagnosis. Of course, make a diagnosis by referring the books, and also you can ask seniors for help. And that is why a college which is having an old tradition will be a better college here. Then cross check with professor's observation. Usually slide will be seen by professor. You make a cross check with the professor's observation. See the slide again after. So match your observation with your professor's observation. See the slide again. Then probably you have to look into the books again, and then what? Cross match. So basically this is how the learning, and that's why I say don't look for teaching, look for caseload, look for case variety, and also look for investigation infrastructure. These three are the most important things that you'll be looking for. These three are the most important thing that you'll be looking for. Yeah. So in that's what in there is DNB in KIMS, then there is Apollo and Indo American. All three are good. They have good infrastructure. All three have good infrastructure. Again, so don't expect anybody to teach you there. So you have to see the slide previous day, make your opinion. Of course, initially seniors will help you, or there is don't worry about academics too much. We have a live resident pathology course on eMedicoz. I take it myself, so which has been running for last 2 years now. So that is there is a live resident pathology course for PG students. So even if there are no seniors helping you out in the college, this will be significant help for you. Okay. And yeah, BJMC Ahmedabad is good for patho. Again, don't expect teaching. Faculty will not, any professor will not be teaching you at a postgraduate level. So I said this is how you are going to learn. So you have to first see the slide and make a diagnosis by referring to books, seniors, or you can even refer. Many students now are referring to live resident pathology classes, that is live and recorded will be available. Recordings will be available. So what they will do is, okay, there's a parotid tumor. They will end up seeing the video quickly from parotid tumor, and then they want cross match, and then they will read that from the book, and then they will make a proper diagnosis. This is how you will be learning in pathology. Okay. So this is yeah, so this is about the live pathology course that we are having. So it will include theory part, practical part, advanced techniques like IHC, flow cytometry, everything. I have introduced journal clubs already. So in journal clubs, many places they don't have journal clubs. How to discuss a journal, how to analyze an article, etc., how to write an article. Then there will be a slide seminar that we'll be having. Then slide reporting I'm going to introduce. And already in this resident course, we have most of the systems are already over. I mean, one round of teaching is already over. The basic teaching of most of the systems is over. So already pre-recorded available for you. So on day one, you will get what almost all systems already available. Only 3 or 4 more systems are left, and by another 2 months, those will also be, the basic will be over. Then next I will be adding up it with advanced diagnostic, like how to use IHC, how to interpret IHC, then fish, all those things will be there. So that will be added. Next, I'm going to start one new thing now. There will be a beginner section. We are going to start a beginner section. This will be specially crafted for new joining batch, which will be you guys. So which will have basics of how to do grossing. Already there is a class about grossing, etc. So these basics will be live, so that you can, there will be a smooth transition for you guys. So that will be there. And yes, all the live course that will be there will be recorded as well. And I would recommend you to take a 3-year course for beginners. So if you're going to start your MD, take a 3-year course, so that the course, the whole material, so you will end up getting recorded classes in this. You will get PDF of the notes. So all these things are going to help you even for your MD exam as well. So the aim of this course, passing MD exam is a byproduct of this course. The primary aim of this course is you to have a proper thinking and a proper approach for every slide that you're going to see. That is what you're going to learn. And passing is a byproduct. You will end up passing if you end up using this course. That is there. And you can use this contact details. You can call any one of the numbers that this number. They will help you out for enrolling once you are enrolled into Pathology PG. Next, I want to talk about one more thing. What is that? Yes. Now, so next thing I want to discuss. Okay, so basically any further queries are there, I will take your queries, guys. BJMC is good, as I said. What's the salary? I told you salary depends. If you want to join and मतलब कहीं पे काम करना चाहते हो तो 1.5 lakhs is approximate salary you're getting immediately after MD. You want to open your own lab, then sky's the limit. I have my friends who have opened lab and they are earning at least 10-20 lakhs per month also. Will it be difficult in getting a job after DNB? No. If you are looking for a corporate job, it will be better for you if you are doing a DNB. Okay. So any further doubts, guys? Any queries which you want me to take? Research opportunities predominantly outside. CMC Vellore is very good. Yeah, I forgot to mention that. Sorry. CMC Vellore should be added in the top colleges. So CMC Vellore is very good. So I will add CMC Vellore before, I would say, MAMC for sure, or before Safdarjung also, but definitely before MAMC I'll be adding CMC Vellore. DNB from Yashoda. Yes, it is good. Yashoda Hospital is good. You're talking Yashoda in Hyderabad, right? Yeah, that's good. Oh, Yashoda in, okay, Noida. Okay. Yashoda in Noida, exactly, I do not know. DNB path in individual hospitals, no, I'll not be able to know. So if you are having any doubt, what you can do is always visit that place. If it is nearby you, go visit that place. Ask those who are already pursuing DNB or MD. Don't ask them, are you happy or not? Because an MD student or a DNB student, it is very difficult for him to be, guiding you. You ask, what is the caseload that you get? What is the variety of cases that you get? What is the infrastructure? Only three things you have to ask from them. Kasturba, Manipal or Mangalore or Vaidehi? Not Vaidehi. KMC is better. KMC, both Manipal, Mangalore better. Mangalore has better caseload. Mangalore has better caseload. Best college in Kerala, Calicut, Trivandrum. First Calicut, then Trivandrum. Prospects abroad after doing MD path in India. So you can go to US, you can settle in Middle East, you can go to some few other countries which recognize MD here from here. But if you're going abroad, you mostly will be joining a corporate hospital. SMS is good. Yeah, SMS is good. So I can keep, I've not included all colleges here. So SMS will be beneath. SMS will be beneath my this list. So in this, I have not included SMS, important colleges which I have not included. KGMU will be beneath this. So then Rohtak, KGMU, then CMC already I have added. Then in SMS, then BJMC, BJ both Ahmedabad, Pune, both of them are good. BJ. Then I will be adding BMC as well, Bangalore Medical College, and then I'll be adding Madras Medical College, and then Kilpok. These two are very good in residency program. Yes, it is for pathology residents. Whether you are MD or a DNB, it's going to help you. Yeah, Madras Medical College is good. Pathology in Central Institute like AIMS Patna, Jodhpur, Rishikesh, not at par with these colleges. So they are almost like tier 2 colleges. So they are not at par with these colleges. uh, MD path in Kolkata, NRS, followed by what is that, CNMC, then medical college. So that is how I'll be going, and then SSKM also. Okay, so in Calcutta, so I'll first will go with NRS, CNMC, CMC, then I'll go with SSKM. And somebody wanted from Jaipur as well. So in Rajasthan, I would say, just a minute. In Rajasthan, I would go with first, of course, SMS. Then I would go with a private college which is there in Jaipur, Mahatma Gandhi, which is a good college, private college. And then I would rate Udaipur, Bikaner, Ajmer. That is how I would be rating in Rajasthan. Diploma anesthesia versus DNB pathology, totally two different things. So what do you want? You want to see no patient, or you want to see sleeping patients? That is the primary difference. And you want, see, pathology satisfaction will be very high. Anesthesia, you have to ask anesthetists. So whether they are telling you what, but you are happy or not, that is what you should be seeing. Average fee for DNB, rough, I think 1,25,000. It is DNB is fixed, I guess. Fee is 1,25,000 everywhere. Stipend will be at par with the state government. Whatever is the state government stipend, that you'll be getting. SSKM, I would, as I said, I would rate it last in amongst the Calcutta medical colleges. First, unfortunately, NRS, that is what I'll be rating first. Then CNMC, and then CMC, and then SSKM. Doon Medical College, GMC Haldwani, at comparison with what? Comparison with what? So always please comparison with what? Microbiology from Central Institute versus DNB path. Again, it depends what are you looking for. See, path is always a challenging in diagnostic sense. Micro is upcoming in research, etc. But diagnostic wise, not much of a challenge is there. There will be culture, but yes, diagnostically very challenging. And path is like more into the patient management, wherein although micro is also, by the way, it has its own. So St. John's Bangalore, good, very good. So I would rate St. John's in Bangalore after BMC. I'd be rating it after BMC, or at least at par with BMC. Kidwai, I'm keeping it up high above here, although teaching anywhere, teaching is not going to be good anywhere. So academics, remember, in many of these colleges, academics is absolutely zero sometimes. Like in Kidwai, very less academics happens, but still, I would recommend them because case load is high. Okay, case load and case variety. DNB anesthesia from periphery versus central patho. No. So it is not about central and peripheral. It is about subject. So what do you want? So what type of person you are? First you decide that. Whether central or peripheral, it really doesn't matter. You are like a person who wants to see patient, then you take DNB and of your anesthesia. But again, even in anesthesia also not much of touch with the patient, because patient is always sleeping when you are unless you are talking about ICU. And work life balance, anesthesia absolutely nil, zero. Many people have very difficult to manage work life balance in anesthesia. Many people have that problem. Yeah, Udaipur, I would keep it down. Udaipur, as I said, I would keep it down in so first in Rajasthan, SMS Jaipur, Mahatma Gandhi, that is MGMC Jaipur Private Medical College, then Udaipur I would be keeping it. IPGMER as compared to BHU has central fund, so more of infrastructure is there. Okay, so I think I have taken most of your doubts, all your doubts now. Micro includes culture, whereas path has wide scope. How different both are in terms of diagnostic use? That's what, there's a lot of difference. Like path is absolutely essential in the sense, you cannot say that I will take a risk and treat this as a squamous cell carcinoma and this as a adenocarcinoma without actually diagnosing. For micro, that is not the case. Many people end up giving antibiotics even without getting a culture and sensitivity done. That is one. Second, your what do you call happiness. As a pathologist, I feel very happy because without my diagnosis, if my diagnosis is wrong, then treatment will also be wrong, and that is how it is. Culture nowadays, most of the culture is automated. So culture, everything is mostly automated nowadays. So there is not much my brain is getting used there. What are the career options? I told you already. You can open your lab, join medical college, corporate hospital, do DM specialized, super specialization, fellowships, etc. SMS Jaipur versus Indore. I really do not know Indore, but Jaipur is good. Kalinga Medical College, Bhubaneswar, no ideas. FRC path after DNB, not much of advantage if you are going to be in India. If you want to go in Middle East or other places, FRC path are preferred. FRC path are preferred there. Can pathologist to start treatment immediately? No. If you are talking about a cancer, I will not be able to start immediately treatment. Why you want to do that? I mean, diagnosing itself is going to take so lot of effort. Why you want to treat the patient after that? So let उनको भी कुछ काम दे दो ना. How is practical of DNB patho structure? Yes, so there will be all things will be included, whether in DNB or in this one. So there will be a few slides for discussion: hematology, cytology, and histopath. They will be giving you slides. For each slides, you'll get 5-7 minutes time. You have to see the slide, describe it, make a diagnosis. That is one part. Second part, there'll be clinical chemistry, which will include your urine and the serum chemistry, etc. That you'll be have to perform. And then there'll be hematology, which will be having peripheral blood smear, bone marrow aspirates to interpret. Then there will be spotter examination, like they'll show you immunofluorescence images, they'll show you flow cytometry, and all those things. You have to diagnose them. This is how it will be there. And all the slides that you're making diagnosis, there will be a discussion on those slides. SR-ship finding is easy after DNB. See, for SR-ship, most of the times it will be an exam nowadays everywhere. If we are talking central institutes, there is exam always. And because there is exam, it will be at par. Whether you are DNB or MD, doesn't matter. 52K MD general category Maharashtra possible or not? Yes, it is possible. You will get pathology at good place. SR-ship is needed after DNB. Again, if you want to see, SR-ship is a must if you want to join a medical college. If you are going into a corporate hospital, SR-ship is not must. Yeah, DNB pass percentage is always difficult. And for a subject like pathology, where there is a wide scope of the theoretical questions, that is why it is tough. So don't worry about that passing result. If you are going to like the subject, then even if you don't pass, and usually what happens is those people who do not clear their DNB, they end up getting absorbed in the system as a resident. They work as 6 months as a resident in that college itself usually. Yes, SR-ship is compulsory to become an assistant professor. Thesis will be the research that you'll have to be doing during your MD or DNB. So you have to do a study, and a proper study. You have to design a study, then you have to do that study, and then you have to publish the results, or in the form of a book, which will be reviewed by some people. Okay, guys. So best wishes all of you. If you are having any further doubts, you can always contact the number that I have given you, and this is my Telegram ID. So you can just always send me a personal message on Telegram. Best wishes, guys. So I'll be ending the session now.
Okay, so I just need a quick thumbs up from everyone if my audio video is visible and audible. It is clear. Can I get a quick thumbs up from all of you? Let me also check. Please give me a quick thumbs up if I'm audible and visible. Okay, okay. Please give me a quick thumbs up if I'm audible and visible to all of you.